Have you ever been eating a meal and told by someone to just slow down and eat more mindfully and have no idea what mindful eating actually is? My name's Mel, I am a dietitian at Active Health Clinic, and I thought I'd do a little video around what mindful eating is, but also wanted to talk about what it might look like for some and what it's recommended to try or to look like for some people, and also challenging that of where it might look different for others. So to begin, mindful eating essentially is being present through the times or throughout the process of eating a meal. And it's paying attention to what and when you're eating and the textures, the taste, the colours, all of those different senses as well, and being present with that meal and how it sits within your body. And this is done from a curiosity perspective with a lack of judgment, and it is supposed to help people, feel more connected with the food that they're eating, but also potentially experience a decrease in discomfort after eating if they are someone who maybe in the past has eaten less mindfully, and that has caused them to eat to a point of what we might call uncomfortable fullness, where we haven't quite recognised when our body is telling us that we are comfortably full and there's still enough room in the stomach for it to mechanically digest and move around, and where we might eat a little bit more and it sits more uncomfortably. We might feel bloated and a bit of pain or discomfort, a bit of nausea, might be burping a little bit afterwards as well. So it can look different for everyone. And more classically, suggestions around how to switch to more mindful eating might be around limiting distractions, for example. And so if you are someone who finds that they'll sit down in front of the TV or in front of their phone and just scroll on TikTok or Instagram or watch a YouTube video while they're eating, and all of a sudden the food is gone, this may be something to connect in with and to go, am I just using the TV as a distraction and not really noticing how I'm eating my food, and you're ending up a lot of the time feeling uncomfortably full due to not really chewing and processing your food in the way that you maybe would if you didn't have a distraction. I'll talk about why this isn't always appropriate for everyone in just a sec. So if that didn't resonate with you, that's okay. But some people may really find that helpful to just remove certain distractions and be more present with just the food and the meal or the company and people around them. Some people might find that still difficult, so they might instead move from the TV to something like an audiobook or a podcast. Also, another recommendation might be trying to pay attention to your senses, like I mentioned before. So it might actually be stopping and thinking, or as with your first bite, connecting in with the taste, texture, smell, flavours, all of the different senses that I can't think of off the top of my head. I know I've missed some, but it might be thinking about that and how that presents, or how you would describe that with the meal in front of you. And you might do that at the start of the meal and more towards the end of your meal, and see if you notice a difference as well. And for some people, that can allow them to just more accurately check in with how the food feels to them. Another example and suggestion is just simply checking in or taking a pause and taking a breather. So some people might set a bit of a guideline where they might go, right, once I finish half or 3/4 of my plate, I'll just sit for a minute, put my fork down and just take a breather. And that's not sit, stop, you're not allowed to touch the food again. It's just a minute to check in and see if we are noticing any signs of hunger, fullness that are different to when we first sat down for our meal. And for some it might be encouragement to keep eating, keep going, and then it might just allow gut and brain to catch up, and for gut to tell brain, hey, I'm actually at capacity, I'm pretty good, thanks. Again, not always the easiest for some people as well. And I always really like to flag the why behind this, because I find mindful eating can be a really helpful tool for some, but for others it can feel incredibly stressful and really inaccessible. And I always like to reassure that that is okay. So I know I've spent time explaining it and going through a couple of strategies that are generally recommended. However, I find it helpful to reflect that a lot of people, for a lot of reasons, and I'll give a specific example, just really don't resonate with mindful eating, and it's something that's really hard. And so an example can be for neurodivergent individuals, and I'll go more specifically talking about people who are autistic or have ADHD. So I'm an ADHDer myself, and I find that there are times that being mindful with food is really hard. And, you know, being a dietitian, that potentially seems like a contraindication for some people, but I find that just looking about this in a way of why and how does my body work and how can I support it better is much more supportive for me than trying to stick to more generalized recommendations. And that's what they are. They're generalized recommendations that can be tweaked for many people. So sometimes I might find mindful eating challenging because I can have poor interoception, and I can struggle to identify what is going on in my body in the moment and what that actually means for me. And there are some days where I'm better at it than others, but there are days where it's hard if I'm more dysregulated, and for multiple reasons I'm going into a meal really rushed and overwhelmed, and maybe that's the day and I haven't stopped to regulate my nervous system in a different way, or I haven't had enough dopamine in a while, I haven't been stimming, I've been masking, many reasons. I might jump into a meal and just shovel it down and not chew my food. And that feels pretty uncomfortable afterwards. So with curiosity, it's kind of connecting in, and this is something that I do with a lot of my patients, is reflecting on why that happens, and is there anything that we can just do to support ourselves a little bit differently? So an example of what I might do is, if I am able to, on certain days, notice that I'm rushing around, I'm a little bit more dysregulated, everything feels fast in my ADHD brain, I'm also going to be moving fast, meaning I'm going to be eating fast. So if I pick up on that, I might stop and do what feels accessible from a regulation perspective. So whether that's just breathing and letting some tension go, or whether it's actually stopping and doing some more in-depth breath work, and by in-depth I mean minutes instead of one breath. It might also be like humming or stimming or shaking it out, having a bit of a dance, or something like tapping, and that's calming if that's what I need. And then I'll kind of go into eating the meal, and I can still have my safe distraction, but I find it a lot more accessible to just recognize that I need to slow down, and sometimes that's enough for me. Other times, and a strategy that I use often with a lot of my neurodivergent patients, is distraction is safe, and it's helpful because thinking about food and going through the senses when you may have sensory sensitivities can be really distressing. So it's taking the pressure off that and going, let's keep our safe distractions, but for example, how can we tweak and modify that so that we are in some capacity just letting our body take a breather. So it might be popping on a YouTube video, and every time there's a break or an ad break, stopping, popping your cutlery down, taking a minute and picking it back up again. And it might be finishing the full meal. It might actually allow someone to stop and recognize on any given day that they're full, and that could be that they're not full after finishing their meal and they may go and grab more. It's not about limiting the amount of food we're eating, it's about just checking in an accessible way. And I recognize that even that, for some individuals, is not accessible. And I think if you have watched this video and you are struggling to connect with mindful eating and think about what it might look like for you or what it means to you, I'd really encourage to reach out to a dietitian who is neuroaffirming and is happy to kind of have a conversation around, is this something that is important for you, and how can we support you with feeling better around food instead of feeling worse and guilty around food and distressed. If you found this helpful, please comment and let me know. If you'd like more videos like this, please let me know as well. But I hope you enjoyed and found something from today helpful or reassuring, and I will see you next time.